It seems like every single day we're hearing another one of those tragic stories. A friend, a celebrity, someone in the news, suddenly just gone. In India, it is the #1 killer. But what's really truly alarming, and the whole reason we're talking about this today, is who it's affecting now more than ever before.
You've seen the headlines, right? A young guy playing badminton, another person at the gym. They look totally fit and healthy one minute, and then the next, they're gone. And everybody's asking, what is going on? Is it the vaccine? Is it some kind of new disease? What's happening here?
Well, the numbers, they're pretty hard to ignore. According to expert analysis, since just 2019-20, there has been a staggering 30% rise in heart attacks among young people. This is not some random spike, you guys. This is a terrifying trend, and it absolutely demands our attention. Okay, now here is where we all need to kind of press pause and reframe our thinking. We call them sudden cardiac arrests, but the reality? It is anything but sudden. What we witness in that one moment of crisis is actually the final dramatic scene of a very, very long play. And that right there is the most crucial point. This is not a sudden failure. It's a slow motion buildup that can start way back in our 20s or 30s, silently progressing for decades before that final tragic moment ever arrives. So how does this actually happen? Well, think of your arteries like brand new clean pipes. When we're young, they're great. But over the years, this stuff called plaque, which is basically made of cholesterol and fats, starts to build up. It slowly chokes the flow, kind of like gunk in a drain. Then one day, the thin little cap covering that plaque just breaks. And the body, trying to help, forms a clot to heal the rupture. But that clot is the final straw. It instantly blocks the entire artery. That is the tipping point. And that final blockage, well, that's what we call a heart attack. It's that exact moment when a section of your heart muscle, which is now completely starved of blood and oxygen, begins to die. It's not a mystery. It's a mechanical failure that's been decades in the making. Okay, so if the blockage is the how, then what's the why? What are the real culprits behind this decades-long process? Now, here's the part I think most people miss. It's not just one thing. It's a whole collection of factors, and the good news is many of them are completely within our control. This is basically the checklist. You got high cholesterol and triglycerides, those are just fats in your blood, then high blood pressure, diabetes, obesity, smoking, not getting enough exercise, and of course, chronic stress. And here's the kicker, you don't need all of them to be in trouble. Just having 2 or 3 of these risk factors is more than enough to get that dangerous plaque buildup started. As the cardiologist, Dr. Bimal Chajjer puts it, for the most part, heart disease is a self-made disease. Now, this isn't about blaming anyone. It's actually about empowerment. It means that the power to prevent this is largely in our own hands. So how does something like high blood pressure actually do the damage? Well, imagine your artery walls are perfectly smooth surfaces. High blood pressure is like constantly pounding against them, day in and day out. It creates these tiny little injuries, almost like cracks or rough patches. And you know how dust settles in the cracks of a floor but not on the smooth parts? It's the exact same idea. That's where cholesterol just loves to stick and start building its dangerous little home. Okay, so we've laid out the problem, we've talked about the causes. I know it can feel a little heavy, so now let's talk about the solution. And it really does require a fundamental shift in how we think about treatment. See, the conventional approach often treats a blockage like a clogged drain. You call a plumber, in this case, a surgeon, for an angioplasty or a bypass to clear it out. But that approach fails to ask the single most important question. Why did the drain get clogged in the first place? If you don't stop pouring grease down the sink, it's just going to clog up again. Dr. Chajjer has this really powerful analogy. He says to imagine heart disease is like a drum that's leaking water from a dozen different holes. Now, plugging just 1 or 2 of those holes isn't going to stop the leak, is it? You have to address all of them. The cholesterol, the blood pressure, the diet, the stress, all at the same time to truly make that drum watertight and actually start to reverse the disease. And you can't do this alone. It absolutely takes a team. First, you've got the doctor, who's managing all the key numbers with medication. Then you have the family, whose job it is to transform the kitchen with healthy foods and new ways of cooking. And, of course, most importantly, you have the patient, who has to take charge of their daily habits. When all 3 of those work together, that is a powerful 3-pronged attack on the root causes of this disease. So what can you do right now to protect yourself? It really comes down to 2 key ideas: preventing the plaque from ever building up in the first place, and detecting it early if it's already there. You know, a huge part of prevention is early detection. And this is one area where technology has been a total game changer. For years, the only way to check for blockages was this invasive thing called an angiogram, where they literally thread a wire through your body. But now there's a non-invasive CT coronary scan. It's a simple 5-minute scan from the outside that can tell you exactly how much blockage is in your arteries with none of the risk. So, who should be thinking about getting this done? Well, experts recommend it for anyone who has major risk factors like high cholesterol or a family history of heart disease. And this is really crucial. If you're someone who does a lot of high-intensity exercise, like running marathons or heavy weightlifting, getting a scan first is a really smart move to make sure you're not putting a stressed system at even greater risk. Let's just not forget what the stakes are here. One-third of all deaths in India are due to heart attacks and cardiac arrest. This isn't some niche problem. It's a national health crisis that's hiding in plain sight inside our very own arteries. Over a lifetime, your heart is going to beat more than 2.5 billion times. It never takes a break. It is the most reliable, incredible engine you will ever own. So the question is, after everything we've just talked about, what single choice will you make today to help it keep running strong?